Hello, and welcome back to another student project review by Group SGDB1. In this video, we would like to discuss about our student project regarding the topic of red cells index in iron deficiency anemia. To give better learning experience, we decided to divide this presentation into a couple of outlines, in which the first one will be the introduction, continued by the main topic, and finally the summary. Right after this, Geg Mas will give us more insight about why we choose this topic and other general information about our student project.
Thank you for the opportunity. My name is Geg Mas Anantalakshmi Oka on NIM number 001. First, I'll explain the background information of our student project. RBC primary metabolic role is to transport gases from the lungs to various tissues throughout the body, where they are used as a source of electron. Anemia is the most common type of RBC disease, characterized by a decrease in RBC below the normal range. In majority of cases, anemia is caused by iron deficiency. In most cases, iron deficiency anemia is moderate and asymptomatic. Diagnostic criteria include anemia, a microcytic and hypochromic RBC index, low ferritin, and iron levels. In this paper, we will discuss the red cell index and its role in diagnosing iron deficiency anemia. Next is the problem formulation. First, what are the red blood cells? Second, what is the red cell index? Third, what is the iron deficiency anemia? Fourth, how does the red cell index affect iron deficiency anemia? Next is the objective. The general objective is to learn and to understand better about red cell index in iron deficiency anemia. The specific objectives are in accordance with the problem formulation. The benefit is to show and to learn clinical science regarding the iron deficiency anemia from various credible sources.
Thank you for the opportunity. My name is Putu Isyundra Kesuma, last number 003, and I'll explain about the definition and the structure of red blood cells. Red blood cells, or RBCs, are one of the type of blood cells that usually called as erythrocytes. RBCs are in charge of transporting gases, including oxygen and carbon dioxide. Oxygen is transported from lungs to body tissues, and carbon dioxide is transported from the body tissues towards the lungs. Morphologically, RBCs contain hemoglobin, and they are 6 until 8 microns in diameter. RBCs are formed in the bone marrow, specifically in red bone marrow, and they have a 120-day lifespan. Next to the structure, red blood cells or erythrocytes have a biconcave and discoid shape like we can see on the slide, and it is also anucleated. And they also have a phospholipid biliary membrane and cytoskeleton. That's all from me. Thank you.
My name is Adjani Sayidina Pakpahan with student number 031. I will explain about the general function of red blood cells. The function of red blood cells is to transport oxygen from the lungs to all body tissues. In mitochondria, oxygen is utilized as an electron source for ATP production, which the outcome will be used to transport carbon dioxide and waste products of metabolic activities to the lungs and to be released from the body. We can find hemoglobin inside the red blood cells. Hemoglobin is an oxygen-binding protein that carries oxygen from the lungs to the tissues. Each hemoglobin molecule is a tetramer consisting of 4 polypeptide globin chains. Each globin subunit has a heme moiety. Each heme can bind and release oxygen. That's all for my explanation. Thank you.
Let me introduce myself once again. My name is Gede Saputra with last 3-digit number of name 018. In this video, I have the honor on sharing about red cells index together with you guys. So red cells index or red cells index is a scale developed by Maxwell Winthrop in 1929, which helps in measuring and counting the mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration of a red blood cell. If the values for hemoglobin, hematocrit, and the number of red blood cells are known, the red blood cell index can be calculated. So how do we calculate these values? Red cells index can be calculated by using the formula shown on the slide. This index is also used widely as a marker for the diagnosis of anemia. Next slide, please. Okay, what is the usage of those 3 values? What does it really mean? So for mean corpuscular volume, it can be used to find the size of red blood cells. Then mean corpuscular hemoglobin can be used to predict the accumulation of hemoglobin per red blood cells. And finally, mean corpuscular hemoglobin concentration can be used to calculate cell volume and hemoglobin content of someone's blood. All the normal values of this index is also shown on the slide already.
Thank you for the opportunity. My name is Julia Caroline and my last 3-digit number is 016. In modern laboratory facilities, blood counts are increasingly performed by automated devices. The 2 most common types are the Coulter-S model and the Hemolog system analyzer. The Coulter-S model counts blood using the principle of electrical impedance, whereas the Hemolog system analyzer using optical methods. And the newer device can measure red cell distribution width, mean platelet volume, and differential white cell count. RDW, which is one of the red blood cell indices often used to indicate iron deficiency, anemia, and cardiovascular disease. RDW is used to measure anisocytosis, which helps further evaluate anemia's classification based on its morphology. Variations in red blood cell volume and RDW also raised in cardiovascular disease. A high RDW is closely associated with an increased risk of cardiovascular causes and mortality. Stress erythropoiesis and variations in RBC survival are mechanisms that explain the association of RDW with mortality.
Hello, my name is Devi Prastiti with last 3-digit number 028, and now I would like to explain about the etiology of iron deficiency anemia. This could happen if iron intake is not enough to meet our body conditions that will cause reserve iron in our body decrease and will lose hemoglobin to carry oxygen, resulting in body not able to compensate for regular bodily activity. It could happen in different situations. First, in a low economic status. It is hard to fulfill the quantity demanded in our body because people can't buy high quality materials, so food is only to satisfy hunger, but never enough to achieve the level of iron needed. Second, iron deficiency anemia could also be found in individuals with increased iron demand, such as children under 5 years old, adolescents, and pregnant women. In children and adolescents, iron needs to be fulfilled due to their body's requirement to develop their brain normally and grow rapidly. In pregnancy, iron needs increase to give nutrition for both the fetus and mother, also to compensate for blood loss in delivery. Third, iron depletion. It is mostly found in blood loss cases such as cancer or menstruation. Massive bleeding acquired from accident or internal bleeding could also be the cause. Individuals who donate blood repeatedly are so liable for iron deficiency anemia if not controlled regularly. I think that's all from me. Thank you.
Hello everyone, my name is Librawan with 3 last digit of number is 029. I want to explain about epidemiology of iron deficiency anemia. Iron deficiency anemia is the most common cause of anemia worldwide because it's about 50% of anemia cases worldwide are iron deficiency anemia. The prevalence of data varies in each country because it is influenced by two factors, namely the social and economic condition. Developed countries such as the United States tend to have a low prevalence of data amounting to 4.5% to 18%. Developing countries tend to have a high prevalence of data such as in South Asia, Latin America, and the Andes have a prevalence of 54.8% and 62.3%. This case is influenced by malnutrition, so countries that are not in line with this factor are more prone to iron deficiency that can cause iron deficiency anemia. I think that's all from me. Thank you.
Hi, my name is Khadra Karin Kamila with the last 3 digits number 009. I would like to explain about the diagnosis part. So for the diagnosis, it will be divided into 2 explanations, which are symptoms and the evaluation. Iron deficiency anemia, or IDA, can be divided into mild to severe levels. Mild IDA are often asymptomatic, but if left unchecked, it can be life-threatening and cause the complications, especially in people with the vulnerable medical conditions. While in severe stages, it tends to show more diagnosable and significant signs or symptoms. Some of the common are shortness of breath, dizziness, pickup, abnormal heart rate, tired easily, brittle nails, and restless leg syndrome. IDA technically can be evaluated through blood tests including a complete count blood or CBC, and TIBC, serum ion, TSAT, ferritin, and transferrin can be used to evaluate for less severe anemia. That's all for me, thank you.
Hello, my name is Putu Kirana with 3 last digit number are 033. I will explaining about the pathophysiology. There are 2 types of dietary iron, heme iron and non-heme iron. Iron absorption is aided by ascorbic acid, citrate, and gastric acid. Hepcidin regulates the proportion of iron absorbed. Hepcidin will travel to the duodenum where it binds to ferroportin and affect ferroportin levels. The expression of ferroportin results in the export of cytosolic iron and ferritin degradation. Next slide. The development of iron deficiency is divided into 3 following stages. The first one is the pre-latent stage. This stage is characterized by iron reduction, but the total of serum iron, hemoglobin, and hematocrit concentration is remain at normal standard. Second is the latent stage. Iron reduction will decrease the serum iron and transferrin saturation, but the hemoglobin and hematocrit counts remain normal. The last one is marked iron deficiency anemia. It is the peak of iron deficiency anemia. Lack of iron will finally decrease the hemoglobin and hematocrit. The next one will be continued by my friend.
First, let me introduce myself. My name is Danissa Dita with last digit number 005, and today I will explain about treatment that can be used for patients with iron deficiency anemia. The first treatment are oral iron, and oral iron has been used and considered as first-line treatment as it is inexpensive and more reachable. Oral iron mostly found in form of ferric or ferrous. After 4 to 8 weeks consuming 100 to 200 mg oral iron supplement, patient hemoglobin level are expected to reach by 2 gram per deciliter. The other treatment are IV iron or intravenous iron treatment. This treatment have rapid and effective effect but only can be used when the oral iron treatment doesn't work. This IV iron treatment have two main forms. The first one is ferrous gluconate that can be given in single dose, and the other one are the iron sucrose that must be given in multiple doses for full replacement. Studies also compared directly IV iron to oral iron, and the result is that IV method is more effective. That's all for me. Thank you.
My name is Putu Krishna Arsawardani Putri with last 3 digit number 027, and I would like to explain about the clinical findings of iron deficiency anemia. Most patients with iron deficiency anemia are asymptomatic and are identified with blood tests. The red blood cell index demonstrates a low corpuscular hemoglobin or MCH and low mean corpuscular volume or MCV. Anisocytosis, hypochromia, and microcytosis of red blood cells can be observed through hematoscopy. Anisocytosis indicates that there is an excessive inequality in the size of red blood cells, whereas hypochromia means that the red blood cells are paler than normal and are smaller in size, or microcytosis. Iron and ferritin levels in serum of iron deficiency anemia patients are also decreased. Guaiac positive stool may also indicate iron deficiency anemia as it reveals a gastrointestinal bleeding through the presence of occult or hidden blood in stool. Physical examination of iron deficiency anemia patient may reveal pallor or paleness of skin and conjunctiva, fatigue, shortness of breath or dyspnea, headache and dizziness, resting tachycardia, and brittle nails.
Every time, my name is Nyoman Gede Sujana with the last 3 digits of number 011. In long-term deficiency, some alterations of epithelial cells can be seen, such as dry mouth, cheilitis, atrophic glossitis, Plummer-Vinson pharyngeal webs, and hair loss. In some cases, restless leg syndrome reveals iron deficiency. Burning tongue, usually accompanied by zinc deficiency from malabsorptions and failure to thrive in babies and toddlers, are less common symptoms of iron deficiency. They were dominated mainly by the symptoms originating from the primary cause of the IDA. In pregnancy, severe iron deficiency anemia is linked with an escalation risk of low neonatal weight, preterm labor, and increased infant and maternal mortality. That's all from me. Thank you.
Thank you for the opportunity. My name is Marvella and my last 3-digit number is 007. I'm going to conclude all of my friends' explanations before and give a suggestion. So the conclusions are: red blood cells, RBCs or erythrocytes, are in charge of transporting gases which contain hemoglobin. Second, red cells index is a scale developed by Winthrop that helps in measuring which values are to explain the etiology of anemia. Iron deficiency anemia is a type of anemia caused by iron intake is not enough to meet our body conditions. Most patients with iron deficiency anemia are asymptomatic and can be identified with red blood indices tests. Lastly, it is highly suggested that medical students need to understand the red cells index and its effects in iron deficiency anemia to accept more medical terms. Thank you.